Sometime in the 1590s, a French king was dying by inches, and his physicians had a cure. They took a red-hot iron, and they cauterized the ulcers as they appeared. When that failed, they wrapped him in blankets and sat him beside a roaring fire until he sweated. And they fed him a silver-grey paste that made his teeth loosen in his gums and his saliva run in ropes. The disease was killing him slowly. The treatment was killing him faster. And nobody could agree on where the horror had even come from. Except that it had come from somewhere else. From someone else. From a country across the border that deserved the blame. This is the story of a disease that terrified Europe for 400 years. A disease so shameful that entire nations refused to admit it was theirs, so disfiguring that it rewrote the rules of beauty, and so feared that the cure became a kind of torture people submitted to willingly. And the strangest part is how completely we have forgotten to be afraid of it. A quick warning before we go further. This one is grim, and every word of it is true. It arrived, as far as the records can tell us, with terrifying speed. In the 1490s, a new sickness appeared in Europe and swept across the continent like fire through dry grass. And from the very beginning, it behaved differently from the plagues people already knew. The first cases were described in Italy in the year 1495, among the soldiers of a French army. Within 5 years, it had reached across the whole of Europe, and beyond it, into Asia, into the port cities of the world, carried along the trade routes and the shipping lanes as fast as human beings could travel. What made it so effective was precisely what made it so shameful. It spread through the one act that people were least willing to talk about. And the first thing every nation did was decide it was somebody else's fault. To the Italians and the English, it was the French disease. To the French, it was the disease of Naples. The Dutch called it the Spanish disease. The Russians called it the Polish disease. To the Ottomans, it was the Christian disease. And in Japan, later, it was the Chinese pox. Everyone, without exception, named it after the country next door. Because to admit it had started with your own people was unthinkable. There is an entire map of European resentment written into the names of a single illness. Nobody wanted to own it. So everybody exiled it across the nearest border. But whatever they called it, it did the same thing. And what it did was slow, and patient, and merciless. In the first stage, there might be a single sore, which healed on its own and lulled the victim into believing it was over. Weeks or months later came the second stage. A rash that could cover the entire body, fevers, aches, and then once again, an apparent recovery. The disease seemed to vanish. People believed themselves cured. And that was the cruelest trick of all, because it had not gone anywhere. It had gone quiet, because after years, sometimes decades of silence, the disease could return in its final form. And this was the stage that carved itself into the imagination of an entire continent. It ate into the bones and the flesh of the face, collapsing the bridge of the nose until it caved inward. It attacked the heart and the blood vessels, and most terrifying of all, it climbed into the brain, and it destroyed the mind, bringing paralysis, delusions of grandeur, and a slow slide into madness and death. Asylums across Europe would eventually fill with patients in the last stages of this single disease, dying by degrees, no longer knowing their own names. If the buried corners of our own history keep pulling you in like this, take a second to subscribe. Digging up the grimmest true stories our species has left behind is the entire reason this channel exists. And stay with this one, because the way they tried to cure it may be the single most disturbing part of the whole story. To understand the cure, you have to understand the fear. For 4 centuries, this was not a disease that quietly happened to people. It was a mark of shame, a visible verdict on your character, written across your face for everyone to read. The collapsed nose became so strongly associated with it that a whole trade grew up around hiding the damage. In London, there were reports of shops that would fit you with a false nose, made of silver or painted metal, strapped or glued into place, so that a sufferer could walk through the world without every stranger knowing their secret at a glance. Think about what that means. There were enough people walking around with faces destroyed by one disease that hiding it became a profession. And into this fear stepped the physicians, with a cure that had a terrible internal logic. The favored treatment, for centuries, was mercury, the shimmering silver liquid metal we now know to be a potent poison. It was rubbed into the skin as an ointment. It was swallowed. It was given as a vapor, with the patient shut inside a heated box or barrel, with only their head protruding, breathing mercury fumes until their body reacted. And it did react. Mercury poisoning produces violent, unmistakable effects. The gums swell and blacken. The teeth fall out. The patient produces enormous quantities of saliva, several pints a day, drooling uncontrollably. And this was not seen as a side effect. It was seen as the treatment working. The doctors believed the disease was being flushed out of the body through the spit. So the more the patient drooled, the more poisoned they were, the more convinced everyone became that the cure was succeeding. Patients endured this for weeks, sometimes for the rest of their lives, in repeated courses. And it gave rise to a grim little saying that survived for generations: a night with Venus, and a lifetime with Mercury. One night of pleasure, paid for with years of swallowing poison. The horror of it is that Mercury may have done something. It does have some genuine effect on the organism that causes the disease, but whether it ever cured anyone or simply poisoned them alongside their illness is a question that hangs over 400 years of medicine. For most of that time, the two great forces acting on the sufferer's body were the disease trying to kill them slowly, and the doctor trying to save them with a poison. It was not always clear which would win. There were other attempts. A treatment using a tropical wood called Guaiacum was fashionable for a time, and mercifully useless, which at least meant it did no harm. Later, in the early 20th century, came the first drug specifically designed to target the disease, an arsenic compound, marketed as the great breakthrough. Trading a mercury poison for an arsenic one was, in its way, progress. But it was difficult to administer and dangerous, and it was not the ending anyone had prayed for. And then, in the 1940s, after 4 centuries of red-hot irons and mercury boxes and silver noses, the whole nightmare was ended almost casually by a single discovery: penicillin. The disease that had terrified the world since the 1490s, that had filled asylums and rewritten the meaning of a human face, turned out to be, in the end, quietly and completely curable by one of the first antibiotics we ever found. A course of injections. That was all it had ever needed. 400 years of suffering, undone by a mold. And this is where the story turns from history into something closer to a warning. Because that victory made us forget. The terror that had shaped European life for 4 centuries evaporated within a single generation, so thoroughly that most people today have never once feared it, and could not tell you a single thing about what it did. It became a punchline, a word in an old song, a thing that belonged safely to the past. But the organism that causes it never left. It is still here. And in recent years, the number of cases has been climbing again, year after year, in country after country, including among newborn infants, infected before they were ever born, which is a form of the tragedy that medicine had very nearly eliminated. The disease did not become less dangerous. We simply became less afraid and stopped watching for it, which leaves us with the uncomfortable thought at the heart of this. For 400 years, our ancestors lived in genuine terror of this disease, and they were right to. We, who can cure it with a few injections, have talked ourselves into treating it as a joke. So the real question is not how they could have been so frightened of something so treatable. It is this: what are we, today, no longer frightened of, precisely because we have forgotten what it can do? Tell us what you think down in the comments.